Good afternoon. My name is Mlili Kasimba, a student of the Kopapet University studying Master of Science Project Management. I'm presenting a study that I'm currently undertaking entitled Assessing the Impact of Organizational Culture on Quality Healthcare Delivery in Public Health Facilities in Chwombo District, Central Province of Zambia. Literature review has highlighted that quality service delivery is one of the main areas of concern for managers in public health facilities. In addition, literature review also highlights that organizational culture is one of the influencing factors for effective quality service delivery in these public health facilities. The study, therefore, took a deeper look into the effect of organizational culture and its different dimensions on quality service delivery by health professionals in the selected health facilities in Chwombo District. We designed 3 objectives. The first objective was to identify the values, beliefs, behaviors, and practices that shape the work environment, communication patterns, and interactions among healthcare professionals. The second was to examine the effect of organizational culture on healthcare processes and patient experiences. The third was to explore strategies for enhancing organizational culture to improve healthcare delivery. Methodology. Qualitative data were collected using in-depth interviews and observations to capture the subtle aspects of organizational culture, and quantitative data were gathered through surveys. Study population included 146 employees, those who represented different healthcare professionals. Purposive sampling was done to include individuals with insights into organizational culture. Lastly, thematic analysis was done for qualitative data, and statistical analysis using SPSS for quantitative data was also employed. Preliminary results. The first area, on whether organizational culture promotes teamwork and collaboration. 34% of the respondents strongly agreed, 30% agreed, 18% disagreed, and another 18% strongly disagreed. 0 neutral in this aspect. On whether organizational culture promotes open and transparent communication, which was the second aspect. 16% of the respondents strongly agreed, 26% agreed, 20% were neutral on this aspect, 18% disagreed, and 20% strongly agreed. The third area, which looked at whether continuous learning for healthcare professionals is important to improve quality service delivery. Only 12% strongly agreed, 16% agreed, another 16% were neutral. Strangely enough, 28% disagreed, and another 28% disagreed. The variation in responses therefore reflects the complexity of how organizational culture impacts teamwork and highlights the need for the Ministry of Health to assess and potentially adapt their culture to better support collaborative practices. Discussion. From the preliminary findings, organizational culture seems to play a vital role in shaping communication patterns, teamwork, and collaboration within these facilities and among the healthcare professionals. Continuous learning and promotion of open communication to enhance quality of care and patient satisfaction should also be emphasized. That it was emphasized by those respondents who were interviewed. Addressing cultural aspect is necessary to hinder effect because it hinders effective communication. Patient-centered culture where patients and their families are actively involved in their care decisions and individualized care plan should be emphasized. This is important because the patients should be part of the goal setting on how they need to improve their treatment or the aspect of care. Conclusion. This study highlights the importance of strategic interventions to nurture a patient-centered and collaborative culture within healthcare facilities. By implementing these strategies, health organizations can enhance the quality of care, patient satisfaction, and overall health care delivery. Thank you for listening.